UK is facing an enormous challenge as it plans for the care of the 1.5 million people who are expected to be living with dementia by 2050. In Great Yarmouth and Waveney, 1 in 5 people over 65 have dementia, above the national average even now. But here they've already established a raft of integrated services working with dementia patients and carers in the community, ensuring better coordination, better value for money and the best care.
We've commissioned a range of services from memory treatment services right through to our intensive support team, our community mental health team for older people, and also some of our inpatient beds for individuals with dementia. So for the professional that wants to refer them, they know where they can refer individuals for their services. For the carers, they know that they're going to get the support, but also predominantly for the patient, they know that they're actually in the pathway and receiving the right services and treatment.
It's about working towards an integrated health and social care system and ensuring everyone knows what successful care looks like.
We've produced a competency framework, if you like, that said this is what providing excellent care for someone with dementia looks like. And then going out to people and saying, you're providing care for someone with dementia, where do you think on all of these lists you are lacking in having that level of excellence? And then we'll go back to one of our education partners and say, we've identified where we need to spend that money in a more wise and efficient manner, and that way we don't waste money.
Community matrons like Rowley Aldiger are part of this drive to provide coordinated, personalised care. He and his colleagues link services to the needs of patients, helping them to stay in the comforting surroundings of their own homes.
We provide a virtual ward service to people with dementia. We aim to keep them at home as far and as safe as possible, and obviously we integrate other services. So we work with other health professionals such as the physiotherapists, occupational therapists. We work with their GPs. We work alongside social services and voluntary organisations such as the Alzheimer's Society.
On his visits, Rowley also educates carers to recognise the signs of potential health problems so they can be treated quickly, avoiding hospital admissions. And whether care is delivered in the community or here in hospital, the aim is the same: to provide innovative services that make a real and dramatic difference to the lives of patients with dementia. On this ward at the James Paget Hospital, memory boxes of familiar items help patients stay connected to their past lives and families, preserving their dignity and helping with memory. The hospital is working to ensure smooth coordination between professionals, like at meal and visiting times. It's also won an award for the This Is Me and More About Me programmes. Simple documents with information about each patient, their likes and dislikes, which also help make sure that they get the right things to eat and drink.
Anybody can pick it up and have a read of it. It tells them information about who they are as a person, i.e. what they like to be called, the jobs they used to have, the family they have. But it also really emphasises on the fluids, what people prefer, foods, what food do they like, but more importantly about making sure we monitor that. So the More About Me really is a catalyst for change for us, because we want to make sure that we've got the skills and we also know about our patients that we want to look after.
NHS Great Yarmouth and Waveney is also part of an initiative across Norfolk and Suffolk to create a groundbreaking dementia intensive care unit, which will focus on research as well as state-of-the-art care. Yet more work to benefit patients facing a future with dementia.